Hello, my name is Byron Hall, and my presentation is on stroke survivors. The goal for this presentation is that students in Health 499C will gain knowledge about stroke survivors. The objectives for this presentation are 1. Students in Health 499 will understand what a stroke consists of with 100% accuracy. 2. Students will identify two types of strokes with 100% accuracy. 3. Students will identify two symptoms associated with a person having a stroke with 100% accuracy. And 4. Students will understand what FAST or FAST stands for. A stroke is often called a brain attack. According to the National Stroke Association, a stroke occurs when the blood supply to the brain is completely cut off due to the lack of blood flow, usually caused by blockages or a brain hemorrhage. The brain stops functioning properly, and a stroke can be treated, but time is the key to survival. The picture to the right shows the two main types of stroke, and they will be discussed later in the presentation. Some quick facts about stroke. First off, stroke is known as the leading cause of disability among adults in the U.S. Up to 80% of all strokes are preventable through risk factor management. And on average, someone suffers a stroke every 40 seconds in America. Stroke survivors is the target group. Strokes can occur at any age, but older people are at a greater risk. The graph to the right shows age group 65 to 85 and the rate of population that strokes occurred. The graph is based on a 10-year interval, and the intervals were 1989, 1999, and 2009. And from the graph, you can tell that those individuals over the age of 85 are at a much greater risk. There are many characteristics for a stroke survivor. Having the ability to recognize that a stroke is happening. Every minute that a person has to wait for treatment, 2 million brain cells die. Change your lifestyle to help prevent another stroke. Keep track of health issues. And participate in a rehab program. 795,000 Americans suffer strokes each year. Among those, 134,000 die each year. From 1996 to 2006, the stroke death rate fell from 33.5% and number of deaths fell by 18.4%. In those years, there were 6,400,000 stroke survivors. A stroke survivor has many issues associated with growth and development, such as weakness, which is usually on one side of the body, balance problems, speech or vision issues, and emotional or cognitive changes. A stroke survivor has special needs that include physical changes, such as loss of balance, vision, speech, or limb movement, mental changes, such as depression or coping with physical changes, risk factors, which affect all race and ethnic groups, and stroke survivors need to have an interest in rehab programs and support groups. The greatest health risk for a stroke survivor is to try and prevent another one from occurring. FAST is an acronym used to help people know what to look for in a stroke. FAST stands for the F is face drooping, the A, arm weakness, S, speech difficulties, and T, time. The next slide shows the picture of the FAST acronym, which shows the major steps of the acronym. According to the National Stroke Association, there have been 3 types of stroke. Ischemic and hemorrhagic are the 2 main types. TIA is a mini stroke. Ischemic is when the blood vessels are blocked. Hemorrhagic is when the blood vessels rupture. Ischemic strokes account for about 80% of all strokes in the U.S. There are many programs that will benefit stroke survivors, such as rehab, nutritional and exercise programs, medication, such as Plavix, Aspects, which stands for Alberta Stroke Program Early CT Score, changes in lifestyle, such as no smoking or drinking, and other health support programs. There are many concerns associated with stroke survivors, the greatest being is getting them to participate in a rehab program. Next is understanding that changes in lifestyle is a must. Everyone needs to get a grip on their health and understand that time is a key element in surviving a stroke. Now it's time to test your knowledge. I'll give you a few minutes to answer. Name 2 types of stroke. Two major types of stroke are ischemic and hemorrhagic. Number 2. What does FAST stand for? FAST stands for F, face drooping, A, arm weakness, S, speech difficulties, and T, time. Number 3. Name 2 symptoms of a stroke. Some of the symptoms of a stroke are weakness, speech difficulties, face drooping. Number 4. What is the key element to survive a stroke? The answer is time. My references are listed. Thank you for listening to my presentation. If you have any questions, my contact info is abhall2 at moreheadstate.edu. I also listed these organizations that offer a great deal of info on stroke survival. These include National Stroke Association, the CDC, National Institute of Neurological Disorders, and Stroke. Thank you.